This is Implant Dentistry with Dr. J. Elliott of Elliott's Family Dental Center in Houston. Over the next few minutes, we'll pay a visit to Dr. Elliott to learn about implant dentistry, the technology and the techniques, and how it can change your life for the better. Elliott's Family Dental Center is in Houston at 4005 Broadway, just a denture's throw from the Gulf Freeway. Dr. J. Elliott combines 21st century technology with his decades of experience, and he's helping solve problems that people have just put up with and taken for granted for centuries. This portrait was done 200 years ago in 1807, and even now it's easy to see the pain and embarrassment on the face of George Washington due to his ill-fitting and uncomfortable dentures.
Anyone that suffers with the lower denture understands the embarrassment, the pain, the discomfort, and the lack of efficiency, and the overall drop in quality of life that comes with that denture. And with implants, you can change all of that. In a very brief amount of time, you can change every morning and every cup of coffee and every social event you go to again for the rest of your life by securing those dentures with dental implants. They won't come out when you laugh, when you sneeze, when you cough. They'll never embarrass you. You'll be able to chew well and enjoy life again in the ways that you did before you lost your teeth. And there's nothing else like that. There's no denture on earth that is as good as real teeth. And by putting implants back in to secure it, you get that same quality back.
Real teeth are anchored by roots into the jawbone. Chewing produces direct pressure on the jawbone, and like any bone, under pressure it strengthens and grows. Traditional dentures are merely glued to the soft gum tissue above the jawbone, and it's use it or lose it. Without direct pressure on the bone, nature tells it it's okay to get smaller. And to say the least, nobody looks forward to the end result. Of course, everyone's familiar with these kinds of dental problems. I went to meet Dr. J. Elliott to learn firsthand about the solutions offered by implant dentistry.
This is a model of the implant that I use most often. As you can see, it's a cylinder somewhat similar to a tooth root. The bone grows around this after it is placed in the jawbone, and once it is secure, then we can place a piece on top that sticks up in the mouth, and we build teeth on it. We build connections to hook dentures, we put crowns on them. Now, I don't want you to think that the implant is this big. This is just a model of it. Otherwise, it might hang down a little bit too far. We don't want it. It's nothing like that. But this is a model of what we do. It goes in the gum and the jaw, and it's buried. At the time of surgery, nothing sticks up in the mouth. You can continue to wear your dentures. You don't have to ever go without teeth. When it's healed, which takes approximately 17 weeks for the bone to grow back around the implant. You heal on the outside very, very quickly. The stitches come out in 10 days. There's not much pain to the procedure at all. I'm always asked two questions about implant dentistry by everyone. How much does it hurt and how much does it cost? And I tell everyone that by and large, the most painful thing is paying for it. Any denture wearer has suffered more surgically by having their teeth removed than you ever do with the implant placement.
We've already covered the substantial negatives of the traditional lower denture, but what did yesterday's technology do for people who are just missing a tooth here or there?
The traditional way of replacing that missing tooth with something that doesn't come out of your mouth is called a fixed bridge. This is an actual 3-tooth fixed bridge. There is one fake tooth in the space and 2 real teeth. The way the bridge is made is the 2 real teeth are ground down and caps are made for them. The fake tooth is attached to the 2 caps, and the entire thing cements in the mouth, like this. At the end, it looks nice. There's no wires showing, no hooks, nothing on the roof of the mouth or anywhere where teeth should not be. So it's very comfortable feeling and looks very natural. The problems with the fixed bridge, however, lie in the fact that, number one, we have to cut down 2 good teeth. If you need those teeth capped anyway because of decay or broken teeth, then this is not a bad thing. But if in fact those teeth are good sound teeth and don't need the dentistry, capping them creates a situation that you will forever have to maintain on 2 good teeth just to replace 1 missing tooth. The other problem with a fixed bridge lies in maintaining it. You must clean underneath the fake tooth, but you can't take the bridge out to do that because the bridge is cemented in. Food debris will get under there, plaque will build up under there, and you must clean it. If you do not, or you cannot, and cleaning under a bridge, especially in the back of your mouth, is not easy, then it is not uncommon to get decay where you see these red marks on the inside of the good teeth, underneath the fake tooth. If you get decay there, then the only way to treat that is to destroy the bridge, repair the decay, and then make another one, which adds, of course, a lot of cost to the situation. One bridge is not a bad thing to pay for. Paying for the second one gets expensive in a big hurry. So today, because of these drawbacks to a fixed bridge, cutting down good teeth when that's not necessary any longer, and the daily nuisance of maintaining the bridge and cleaning under it, very often now it is better to place a dental implant in the space of the missing tooth. This way you do not touch these teeth. If they don't need the dentistry, you don't add the dentistry and the ongoing burden of maintenance and repair that entails over the course of a lifetime. You replace only the tooth that's missing. It is not connected to these, so that if anything happens to one of these teeth, it doesn't happen to all of them. The implant also maintains the bone. As we said earlier, the bone melts away after the tooth is gone. A bridge puts the tooth back so that you can chew, but it does nothing to maintain the bone where the tooth was lost. If that tooth is in the front of the mouth, then over the years that shrinking of bone up in the front can become unsightly. The implant helps prevent that. Today, an implant is the most modern, most efficient, and best alternative to replace the single missing tooth in most cases.
So, whether you're replacing an individual missing tooth or you want an improvement in your lower denture situation, either with the snap-on post technique or Dr. Elliott's favorite, the permanent bar, you'll be amazed at the difference dental implants can make in your look and your outlook on life. It's the direct pressure on the jawbone that causes the bone to strengthen and grow and fills out your face to more youthful proportions. Only dental implants can give you this kind of result. Dr. J. Elliott is a graduate of Loma Linda University's School of Dentistry. He has a diplomate from the American Board of Oral Implantology and Implant Dentistry. And not only is he certified by the American Academy of Implant Dentistry, he's also an associate fellow.
If there's any way that implant dentistry can help you, I'll be more than glad to show you what can be done and answer any questions you have. My phone number is 713-644-4331. We're at 4005 Broadway in Houston, Texas.
Why not bring your teeth into the 21st century with the comfort, convenience, and durability of dental implants from Dr. J. Elliott? Call Elliott's Family Dental Center today on Broadway, just 10 seconds west of the Gulf Freeway.